Welcome back to Upfront. They are called COVID long haulers, people experiencing debilitating symptoms weeks or even months after COVID-19. Ascension, Wisconsin has just opened a clinic in Oak Creek for some of these patients. And we're talking now with a doctor and a patient at that clinic, Dr. Erin O'Toole and Maria Whitliff. Thank you both for being with us. So, Maria, I want to start with you. First of all, I'm so sorry that you're still feeling symptoms. This sounds like quite the ordeal. And I know that you tested positive for coronavirus in July. It's been almost 5 months now. Tell me what it's been like since then.
At first, it was really quite horrible. The exhaustion was horrific. All you want to do is lay around or sleep. You have absolutely no energy. I had a lot of problems with memory, loss of memory, short-term, long-term, balance. I was so weak. Fortunately, doctor has the setup at the hospital for, you go for respiratory physical therapy. I went for 4 weeks, and then we had decided that I still wasn't progressing fast enough, so we added additional 2 weeks to it. So that did help tremendously. It really did. Had I not gone for that therapy, I would probably still be laying in my bed.
Wow. And I think one of the fascinating things that you were telling me earlier is that when you originally had coronavirus, it only lasted a few days and you thought you were over it, but then a month later something else happened, right?
Right. And I had heard that people with underlying conditions, it can come back after a month, and lucky me, it did.
Right. And I know you have asthma, and that's when things got really scary, was a month later. And so, doctor, I want to ask you, is this what you're seeing in some of your other patients, or how does it go for these so-called long haulers?
Yeah, so there's quite a variable presentation for folks that have the kind of the acute phase of the illness, and then how it kind of transitions into a longer post-acute phase or into the chronic COVID or long COVID period. And so just from a definition standpoint for folks, if you have symptoms that last longer than 3 weeks, we start to think of you as post-acute COVID, after your initial insult with the virus. And then up until about 12 weeks, you're kind of in that post-acute period. And then after 12 weeks is when we're calling it chronic COVID or long COVID. The definitions are still not quite well defined yet, as is kind of an evolving picture. But stories like Maria's are quite similar, kind of across age groups, and regardless of whether or not they have underlying pathologies, unfortunately, is that people just will have a bout of illness and think they're over it, and then things will just continue to be residual, and which can be kind of quite trying from a mental standpoint.
Do you know how long symptoms could possibly last? Because obviously coronavirus is still a newer thing that we're learning about. I mean, how long could some people have symptoms?
Great question, which we don't really have an answer for yet. I think we had the 1 year anniversary last week, I believe, of the first diagnosed human transmission. And so in the States here, we've been dealing with coronavirus for about 8 or 9 months. We've come a long way in terms of how we diagnose and treat the acute phase, but the long phase period is really still an open question.
And Maria, I wanted to ask you, we talked about the physical aspect of this, but I'm sure there must be a mental aspect too. I mean, how are you doing going through this?
For me, it's been exceptionally horrible due to the fact that, we had the lockdown, and we lost family members. My children lost their father. And because I was in isolation, I couldn't even be with them. Then 5 days later, my aunt passed. And we still haven't had a funeral for my ex, but to be alone and you have no human contact, it's just excruciating. It's absolutely horrible. And I got to the point after a couple of months that I realized I am in a depression. And if I don't ask doctor for help, I'm going to be really bad. So I did contact him, and I told him I'm to the point where and you can't stop crying and all of, everything is negative. You have to do something about it. You can't just sit there and act like nothing is happening. You have to ask for help.
Maria, you have gone through so much. It's honestly tough to fathom. I'm so sorry to hear all of that. And I'm glad that you are getting some help. I mean, doctor, talk to us about, do you know how common these long hauler symptoms are? Any idea what percentage of COVID patients end up having this?
Also a really great question that we're starting to get early data on. So there's some very early data from Italy, actually, one of the primary hot zones from that first wave of infections through Europe. And they were documenting about 50% of people would have some kind of residual symptoms after 3 weeks. Some studies out of the UK suggest more like 10% in analysis that they've done. But, you start to think about those numbers, the number of the millions of people in the States specifically that have been infected, and you run into a pretty high number of people that are going to have some kind of residual symptoms.
Right, that's a lot of people. So, doctor, I just want to wrap it up by asking you about this clinic in Oak Creek where you're specifically treating long hauler patients. What do you do there?
Sure. So really the goal for this kind of post-acute COVID care clinic is to provide a touchstone for folks that are having the persistent symptoms, to provide a comprehensive approach for this evolving picture, right? We don't have any kind of magic solution that's going to help people get better right away, because that just doesn't exist. But we have to at least think about this as a new problem, and we have to maybe address it in ways that are not what we would normally do in primary care, specifically where if you have a cough, you should get treated with X, Y, or Z. We have to think about it in a little larger scope. And so to do that, we're addressing that through a multidisciplinary means where we've got cardiology and neurology, physical medicine rehabilitation, and their physical therapy teams to kind of look at these cases on an individual basis and kind of create care plans for each individual to help address the issues at hand, whether that's physical, like in the specialties that I just mentioned, or if it's psychological. We've got therapists and psychiatry and neuropsychology in addition to help those issues as well.
Okay, well, doctor, thank you so much for your expertise on this. And Maria, thank you for being so open and sharing your story. Hopefully it can help other people. You will certainly be in our thoughts, and we hope we can follow up with you in the future. Thank you so much.
Thank you very much.
It's a critical season for retailers and an economy powered by consumer spending. We'll check in on the health of the state's economy. That's next on Upfront.